Hi everybody, it's Jaden speaking here from Recharge Physio. Today I want to have a quick talk about tennis elbow or lateral epicondylitis or lateral tendinosis of the elbow is probably a more accurate term. The reason being is when they've done biopsy of the tendon, that's when you're getting pain through here. Often when gripping or squeezing, you can see the forearm muscles connect up into this part here, the common extensor origin. Also, if you're pouring a kettle or jug, you might be getting loading through there or repetitive gripping activities. So pain in this region here with palm down lifting works that tendon through here. If it's still, one little trick is you can do palm up lifting, which works more on your flexors rather than your extensors. You can get a tennis elbow support, which is just positioned there. It just transfers the load from the origin of the tendon here, and it transfers it around the forearm, so you can get what's called a tennis elbow support. Even from the chemist warehouse, you get some great supports as well. I'll talk a little bit about the anatomy, and then we'll show some corrective exercises that are really helpful as well. With the anatomy of the elbow, you can see the common extensor origin is in through here. So if we look at the body, everything that's red has a good blood supply, which is basically muscle, and things that has a poor blood supply is white. So tendons tend to be slower healing than muscle. And when they've done biopsy of the tendons, are saying they found that there's no inflammatory markers, there's degenerative markers, but not inflammatory markers. And strengthening is one of the main important things that it can do to help. So when strengthening the forearm extensors, one of the things that's good to do is get a light dumbbell you could do at least 10 to 15 repetitions pain-free with. So in my case, I've just got a 2.5 kilo. You might go even lighter if it's a bit more irritable as well. And so basically it's palm down strengthening of the extensors through here. So just going through here, palm down strengthening, just in the small range of motion. Starting off with 10 repetitions, build up to as many as 20, as long as it's pain-free. If you can do more than 20 repetitions, you can do another set. And also, if you can do 2 sets of these exercises, do these 5 days a week. Give yourself the weekend off. In a gym-based setting, another thing you can do is just with a little T-bar for tricep push-downs, is you can do some rotation. So strengthening your rotating muscles are really helpful as well for tennis elbow. Starting off with in the middle, which is with slow leverage, palm up, palm down, then you can incrementally move your way down the bar, and that will help to strengthen and stabilize through the forearm rotation and wrist extensors. And that will build greater resilience of those tendons and help the regeneration and thereby the pain. Now, these exercises you need to do about 5 days a week, and generally for about 8 to 10 weeks to get a really significant change in the strength of the tendons. It's saying tendons are slower healing than muscles because of the poor blood supply. As well as that, it's often a good idea to address any other issues. So commonly one of the things that can happen is you get stiffness around through your upper back or shoulders. If your body has limitation in another part of your body, whether that be, say, the shoulder joint or the middle back, for example, it can be a risk factor for developing overuse of those extensors. So get that checked out if you have some stiffness elsewhere as well. Have a great day.